Well, for the past couple of days, Gauteng has been dominating the daily COVID-19 infections. The country recorded over 7,600 new COVID-19 cases in the last 24 hours. Gauteng accounts for 4,891 of them. Are Gauteng general practitioners well prepared to actually deal with this third wave of COVID-19 infections? Dr. Daniel Israel is a family doctor at Bluebird Medical at Melrose North of Johannesburg, and he joins me now for this conversation. Dr. Daniel, thank you so much for joining us this evening. Under how much pressure is the healthcare system in Gauteng?
So thanks for having me, Faith. We're finding as outpatient doctors that we're back knee-deep into the problems with COVID. This time we are a little bit more in the know because we've done this once or twice before, unfortunately. But the system, certainly in Gauteng as a province, is under a lot of pressure, with bed shortages being an ongoing problem for us as general practitioners.
Yeah, I mean, speaking about bed shortages, capacity, oxygen tanks and the like, is there enough capacity? Do you have enough resources to even handle this third wave?
So, Faith, we've learned, thankfully, in the last two waves that the majority of COVID-19 patients don't require admission. And we feel much more equipped through studies that have been done internationally and through our leadership in terms of, specialists and intensive care units in Joburg of how to manage the average uncomplicated patient. The difficulty comes in when a patient is not managing with drugs at home and oxygen at home, and then the patient requires a bed. And when patients need intravenous treatment and more invasive ventilation, we are certainly struggling to find, both in the private and the public sector, beds. And my colleagues and I have spent time this weekend alone, trying to just phone around and look for beds for patients who have needed it. And this is certainly becoming a worry.
Yeah. Are you concerned that the psychological well-being, as we've seen with the first wave, in fact, in this country, that the psychological well-being of general practitioners, doctors, nurses, those that are in the front line will be compromised if we continuously put pressure on the system, if we refuse to adhere to COVID-19 regulations?
Absolutely, Faith, and we're seeing it already. My colleagues and I are exhausted. It's a question of dealing with patients' anxiety first when they think they have COVID, then managing them at home, and then obviously the more difficult cases, one or two difficult cases in a day can create a lot of emotional and psychological pressure or trauma for doctors. The real challenge, I think, for general practitioners is how to best educate patients and people of the public as a whole of prevention measures so that we're not constantly faced with questions from people who have had exposures that could have been prevented.
Is there fear among general practitioners that indeed Gauteng could become the new epicenter?
I think at the moment Gauteng probably is the new epicenter. In other words, if you look at where the majority of cases were, in the last day or so, we can get 5,000 cases a day just in Gauteng. But the question is whether we can cope with that. Look, thankfully we have the most resources here, but certainly it's a fear. The hope is that the wave will go down, and then hopefully it won't be as severe in other provinces.
And if you had to give advice into the ether out there, Dr. Daniel, would you say we need stricter lockdown?
So, Faith, I'd say prevention is better than cure. We've learned that. This is a condition that's treatable at home if you're one of the fortunate ones not to get it bad. But the people who are affected quite badly, really go into slippery slopes. So, unfortunately, if the only way we're going to have prevention is by having a stricter lockdown, then so be it. I really was of the opinion initially that some of the economic lockdown was unnecessary, but the reality is that we've seen that with COVID fatigue has set in, and with people not isolating as they used to and not taking it as seriously, we might be heading ourselves into a direction that is the only way that we can not overburden the system.
Dr. Daniel Israel, we'll leave it there for this evening. Thank you so much for joining us, a family doctor at Bluebird Medical at Melrose.